Alright everybody, this is just a little video to go through a couple of things you can do if you have any lower back issues or complaints or grumpiness. So you'll need a couple of tennis balls and a little bit of floor space. So usually what you find is one of the muscles that typically gets grumpy is one called quadratus lumborum or QL. It attaches from the 12th rib, so just at the very base of the rib cage here at the bottom, and it fans and attaches then to the iliolumbar ligament. It kind of blends into the iliolumbar ligament at the base of your back. So as I said, it kind of runs in a fan direction. It helps in side bending and rotation of the pelvis and the spine. It's a busy muscle. It's involved in a lot of things. So that muscle might be underactive, it might be overactive. So it's a really good idea if you have any back pain just to get checked out to see what's what with it. But this is something you can do in the meantime, or you can try it in the meantime and see if it helps. Obviously, if things get very sore, you need to stop what you're doing and get checked out. So as I said, a couple of tennis balls is perfect. If you only have one, that's fine too. You can just concentrate on one side at a time. So in a second I'm going to lie on my back, and the movement I'm going to do with my pelvis, I'm going to rock it forwards and backwards, right? So if we use your pubic bone at the front here as a reference point, we're going to let your pubic bone go towards your feet. That's going to bring your spine into an extension, and then you're going to rock your pelvis backwards. So your pubic bone is going towards your chin. So you're going to do that when you're lying on the ball, and you're going to go really, really gently with it. We're not going to be digging into the tissue because you might be bruising into the tissue, and we just want to go super gentle with it. So you'll get the two tennis balls, and you'll just find the spot just at the top part of your pelvis here, and you'd start there. So you pop them in here, you do the movement with the pelvis, which I'm going to do in a second, and then you can kind of work your way up towards the bottom of the rib cage. Alright, so if I'm lying on my back, and I'm going to just pop the two tennis balls behind, I'll just take my pelvis here. Alright, so feet are flat down, knees are bent, and as I said, we'll use the pubic bone as a reference point. You're just going to rock your pelvis forwards and backwards, and you probably find one or two sort of sticky spots there. So if you find that, you can just make your movement a little bit smaller, alright, just to kind of work through that. And as I said, go really light. You don't want to be putting a lot of force with this at all. Then what you can do is you can kind of rock the knees over to one side. That'll let the ball become free, and then you can rock back over on it again. Do the same on the other side. So you'll let the ball up, and you can just gradually then begin to let your pelvis rock forwards and backwards. And as I said, go up towards the bottom part of the rib cage. Alright, so when you have that done, see, it's spend about 2 minutes or so at that roughly. When you have that done, it's really important to do a little activation then as well. So just to kind of get things moving and working again. So you can stay in the same position here with your knees bent, feet flat. Arms are long on your mat or down on the floor. And you're going to let your pelvis tilt again, alright? But this time what we're going to do is we're going to press down through your feet, and you're going to roll the spine off the mat just until you get to that bottom part of the rib cage. You can hold it there, and as you're holding, really press your feet down into the mat. Then roll back down, so you're getting each joint in your back to make contact with the mat as you're rolling down. And go really slow and be precise with this. And again, we're going to roll up. As you're rolling up, we'll try and breathe out. Push your feet down, and when you're pushing your feet down, you're going to find your glutes at the back here possibly activating a little bit or loading. You might feel hamstrings. If it's very dominant in your hamstrings, if you're feeling too much in the hamstrings, walk your feet in a little bit closer to you. Alright, so you're not going to kind of strain anything there. Roll back down. So do that about 3 or 4 times, and then what you can do then is you can just bring your knees in towards your tummy, and you can rock them around. Another little activation that you can do, which I really like, is in an all fours position. Grab a book or a cushion or something like that, just to put in the top of the pelvis, and that just gives you an awareness of where things are in space, alright, so where your pelvis is. So with this, we're trying to keep your pelvis as still and as steady as you can, and you're going to let a leg slide. Now when you're letting the leg slide back, you're not letting the pelvis rock or drop. So slide it back, keep everything as steady as you can, and if that feels okay, then you can begin to lift the leg. Alright, hold it there for about 3 or 4 seconds, and then lower it back down, and then you can repeat on the other side, okay? But you're staying really steady, and you're keeping your body weight centered, alright? So you're trying not to shift your pelvis over one way or another, alright? If that still feels all right, you can add in an arm, but we'll go with the opposite arm, all right? So reach the leg back first, and then you're going to slide the opposite arm forwards, and you're going to try and bring your arm towards your ear. Okay, so this is a really nice activation for multifidus, okay? So slide back with the leg, then reach the arm forwards. And as I said, you're keeping your body weight centered. So you're not leaning on this bending knee, all right? Hold that for about 3 or 4 seconds and lower back down. And then you can switch that again, all right? So there's a few little movements that you can try just to help with any lower back issues. And as I said, do get yourself checked out just to be 100% sure.